Hi, I'm John Clark with the Posture Pain Connection. Today we're going to be going over the menu on page 166 of the revised and updated second edition of Pete's book, Pain Free. Now there's a first edition of this book that looks like this with the blue and red and white. We're not looking at this book today, we're looking at the revised updated edition. So just know that it's on page 166 there. I'm a certified postural alignment specialist, which means I've received training from the Egoscue Institute and have been certified in teaching this method of postural therapy. I'm going to be helping you go through the exercises in this menu and give you an idea of what they're doing, why it helps, and some tips and pointers along the way. Now, I just want to be sure to know that this is not intended as specific medical advice for you personally. Your health has to be your responsibility, and keep in mind how you feel before trying anything that might affect your body. So, the menu for lumbar or herniated disc pain. That's what we're covering today, right? Now, this menu consists of 7 different exercises. One of them is performed twice. So, it has a total number of steps in this routine of 8. Let's go ahead and talk a little bit about why they work. When I first started out my journey in postural therapy, I was noticing things that were helping my body, and I was in a wheelchair at the time. And after a couple months, I was able to stand a little bit, take a couple steps, but I really didn't understand why these things were working at that time. And that was one of the things that I found lacking in the book was an adequate explanation. I couldn't figure it out. Why is this working? So I'm going to talk a little bit about that in regards to this menu specifically. Let's look at the first step. Sitting knee pillow squeezes. The actual postural differences that we're making in our body with this exercise are bringing the femurs to a more balanced rotation. So if one femur is pointing out more than the other, this is really going to bring them to pointing out the same direction. And this is also going to help reduce rotation in the hips and pelvis and possibly even the lower back. Now the next step, we do those knee pillow squeezes, but in the static back position. What this does is helps ensure that both our shoulders and our head are all in the same, and our hips and pelvis are all in the same plane horizontally. That's going to help decrease compensations while also strengthening those adductors, reducing the rotation in the femurs, the hips, and the pelvis. So it's really just a further step into that same exercise or that same motion. Next exercise, modified floor block. What we're achieving in this exercise, well, in the other one, if the femurs were already external, like so many people with lumbar pain seem to exhibit, we've already kind of got them more to be at the same measure of external rotation. In modified floor block, we notice that our feet are pigeon-toed, right? So now we're trying to bring those femurs back into a more neutral position so there's no rotation at all. And at the same time, we are reducing rotation, again, in the hips and pelvis by placing the hips flat on the floor. We are releasing and letting the low back relax because we are taking the shoulders back, and it really lets that lower back curve, right, when we're in that position. And that's going to be reducing compensations in the upper back, and also when we have our arms back like this, it's going to be reducing disparities in shoulder elevation, rotation of the shoulders, internal rotation of the shoulders. If you see, like I used to have that kind of ape-like walk because my shoulders rolled in so much. And finally, next we get to static extension. Static extension is great for repositioning the spine, so like kind of decreasing scoliosis, strengthening the hips and the pelvis, strengthening the shoulders because we're holding ourselves up. So there's a lot going on in that exercise as well. Next we have air bench. Well, if you've tried air bench, you know that it puts a big load on your legs, your upper legs, your lower legs, your ankles. Your ankles are in plantar flexion, your knees are in flexion, your hips are in flexion, and then we have the upper body in a upright neutral using the wall to keep all those joints in vertical alignment. So there's a lot going on there. This really can be good for anterior pelvic tilt, for reducing anterior pelvic tilt, and for complex reasons it can be good for people with posterior pelvic tilt too. But it's really great for strengthening and reinforcing those changes that we got in the knee pillow squeezes and the modified floor block. So we're moving into like the strengthening portion of the menu at that point. Now, static back, that's probably, in my opinion, that's after air bench, because if you're just starting out in postural therapy, you're probably going to need a rest after air bench. But it's also going to help reinforce, and it really is like air bench is a vertical version of static back almost, right? So it's a very similar position, but now we're lying on the floor rather than up against the wall. Lying supine, well, that is going to have a lot of the same effects on the upper body as static back, right? Your lower back's flat on the ground. But now we're promoting hip extension rather than hip flexion like we were in static back. So now we're kind of preparing ourselves to be upright. This lying supine is a standing position, and by squeezing that block, we are strengthening our adductors. We are correcting knock-kneed, so knees going in, or bow-leggedness, knees going out. That exercise is great for correcting both of those postural deviations. And finally, air bench again is the final strengthening step, preparing our body to be upright, strengthening those legs, strengthening those hips, strengthening the ankles, and keeping our upper body in a neutral, load-bearingly even position.